This is, what do you even call this? Pet tour? Painkiller? Come here. Come here. Okay, I'm gonna try to get the rest of this out in one big squirt. Come on, bud. Okay. Now, the antibiotics. And then the flush. Whose stomach is that? Yours or his? Huh? Come here, bud. Come here. Come here. Come here. He does not want anything to do with this right now. Come on. Come on. RJ. This is one of the last times you gotta do this, bud. Well, so this guy, go on his head right here. He got in a fight with another cat and it caused an abscess, and the infection got deep into his tissue and he's a little loopy right now. You can see how big his pupils are if he opens his eyes. But he's a really good cat. They did surgery on him and we have to flush these 2 incisions right there and get that string and kind of floss it through his head. And so yeah, we gave him medicine, we gave him Pet-Torb and some antibiotics. And now we'll just kind of show you what we do to get ready for this. My fiance is the professional at holding him to make sure he doesn't go crazy. But you get some of this, get the water warm, right? And then you want this to look kind of like a tea color. So I'll put a little bit more in. And then we get gauze pads. We usually just put 4 of them in there. And then I use these to wipe the incisions and get everything clean. So we do that. We put this in his head, flush it out. And then when we're done, we put this ointment inside and around. And we stick him in the sink right here. But he's really good at doing this. He'll sit here and purr and lay in the sink. We're gonna have her try to record this as best as she can while watching him. And it's very important to have clean hands while doing this. Wash your hands before and after, so no infection comes up. This is what I'm doing, just wiping kind of scrub a little bit to get that dried blood up. And the warm water in solution really helps. We tried it the first couple times with like room temperature, wasn't it? Yep. I'm gonna get a lot of hate from anyone who watches this because you're just ignoring me. I don't even know if YouTube would like let me keep this on for a while. I don't know, hopefully. It's supposed to be educational. Really get in there. And this happened on, the surgery happened on Saturday and it's Wednesday now. We've been doing this twice a day. Once in the morning with the painkiller and the antibiotic, both taken orally, and then flushing twice a day. We usually wait about 10 minutes or so after we give him the painkiller just so we can get a little drugged up and not be fussy. But we didn't do it this morning, and it's a little stiff right here. But this hole right here, this incision has been bleeding. This one over here has been really good. Just take your time doing it. Try to get as much blood off as possible. And they'll really like you touching and rubbing right here or anywhere, because they're gonna have a cone, and more than likely they won't be touching it. So having you touch it and move everything around is gonna feel good to them. Okay, let's see. It wasn't as bad as I thought. We'll get that little clump cleaned out a little. You okay there? And there hasn't been hardly any blood the last couple times we've done this. Well, I think the worst was when we were at the vet and the nurse was showing us. But get your curved syringe, stick it in the incision. Try your best to cover up their eyes. And a lot of times, pretty much every time what we've been doing when we do this is I'm talking to him, telling him he's a good boy. Kind of like positive reinforcements. Just so he has, so it's not like, I don't know, not so terrible. Sometimes it can be. So yeah, that's really good right there. depending on where their head is, you don't have to cover their eyes. That's why I didn't cover it right there, but it runs down the back of his head. And that was really good. So you're a good boy, RJ. Give him loves. That's what he wants. And he hasn't stopped purring this entire time. So we'll get this, kind of floss it through his head. See if there's any pus that comes out. There's a little bit. A little chunk of something. That was just fur. So we're good there. And okay, so what we're gonna do is do one more flush just to make sure. And it's been like we skipped this morning on accident because we've been getting up the last couple days really early, like 5 in the morning, to take care of this, and then we both go to work, and we come back and do it again when we're home from work. And so I'm just gonna do a little bit more of a flush just to make sure everything is out, but it looks really good. So yeah, that looks really good. Just kind of floss it a little bit. Sometimes there's a couple of clumps of hairs that'll get caught. But he seriously has not stopped purring, and he is an amazing cat. I think he just turned 4, or is about to turn 4. So we're gonna get this in. Yeah, that looks amazing. Go more squirt in this incision. You're doing good, bud. You're doing good. Okay, we're done with that. Wipe him down, get all the solution and water off the top of his head. Now let's put the ointment on. It's the same thing. Try to get in the incision, kind of like that. And if you can get in the actual incision, that's better, just because you're ensuring that it's going in. And use that string just to move it around. And he's really not feeling any pain at all. It's gonna be more of a pressure or a discomfort maybe, but no pain. He's not gonna feel anything. It's not gonna hurt him, especially with the painkillers. But we probably are gonna cut the video right here and go grab some scissors so we can cut this off, and we'll show you. It's just like stitches. And that is that. So now we're gonna cut the string off, and what I'm doing over here is getting all whatever germs are on these scissors off, just using that solution. I'm not gonna be surprised if like something comes out, like a hairball or something. I just hope nothing does, but again, he's not gonna feel anything. It's just like stitches. Pull it on out. So now with that little string out, we can go ahead, make sure all this hair's off. Go ahead and put some more ointment into the incisions, and then on top and this one right here is the one that's been, all the blood's been coming out of this one right here. So we'll just keep an eye on that and make sure that when it does bleed, we'll just kind of pat it dry and make sure the blood's off it. But he's been really good with this, and just like that, kind of dab it a little bit, and we'll just let Mother Nature take her turn and let him heal. And it's going to take a couple days, but we're going to leave this cone on, make sure he doesn't do anything to screw up his head anymore. But that's that. So yeah, thank you for watching, I guess.